ASD, all of us, we need to begin with the how the atrium septum is formed. So let's do one thing. Let's do a very quick revision. How is the septum formation happens in case of the atrium? So all of you tell me, if I'm drawing this heart here, and in the center, if I'm using this blue color, all of you tell me, what is this blue color here? What is this?
Endocardial cushion.
Right, so it's an endocardial cushion. So we already know that in the atrium, when the septum is being formed, first of all, one septum will start coming down, and this septum is going to be called as which septum?
Septum primum.
Septum primum.
Septum primum.
Right, and you already know septum primum is anteriorly present or posteriorly present?
Posteriorly.
And septum primum is going to be flat shaped, or it is going to have the crescentic shape?
Crescentic shape.
Right, and due to this, there is going to be some opening, and this opening have been given a name. We call them ostium primum. So you already know that the septum primum will lead to the ostium primum, and then we know that we have already discussed this thing, that after some time from the endocardium, now the ostium primum slowly and slowly will start being filled up, but nothing to worry about, because by this time in the septum primum, in some area there is going to be the apoptosis going to begin, and due to this apoptosis, later on there is going to be formation of a new opening here, and this new opening have been given a name. What do you call this new opening? Ostium
Secondum.
Ostium secondum. Very good. So now we have got the ostium secondum. Then a new septum will start coming down, and this septum is going to be called as the new septum is going to be called as the septum. So what is this green color here? You tell me, what is it called, the septum?
Septum secundum.
So we call it septum secundum, and you already know that the septum secundum and the opening, right, the ostium secundum, they are going to lead to one situation where the blood can very easily move from the right heart to the left heart, and this condition, this situation, this particular structure have been given a name. We call it foramen ovale. And you also know that this foramen ovale, right, it is going to help the movement of the blood from the right side to the left side in the fetal life. But as soon as the pressure in the left side will be more than the right side, then no blood can go from the right side to left side, then it will be functionally closed. And later on, this foramen ovale is going to convert into which structure? What we call this name? We call it
Fossa ovalis.
Fossa ovalis.
Right, so we have already discussed this thing. Now today, when we are talking about the ASD, we need to learn about few things today. That what are the types of ASD? This will be one very important thing to learn. Then we'll learn that what are the manifestation of ASD. Then we'll learn about some diagnostic tool that we use in the diagnosis of ASD. So all of us should focus here. Keep in mind, the ASD can occur, theoretically, it can occur in any person of the atrial septum. It can happen in the septum primum, it can happen in the septum secundum. At the same time, it can also happen in the sinus venosus. All of you remember where is the sinus venosus? All of you tell me, when we learned about the cardiogenesis, we learned that two tubes will come together. What we call this tube? We call this tube as endocardial tube. And then we learned that this endocardial tube will convert into another big tube. What do you call this big tube?
Cardiac tube.
Cardiac tube. And this area is going to behave as a truncus arteriosus, while this area is going to behave as a sinus venosus. And you already know that in the right side, the sinus venosus will be leading to, in the right side, it will be leading to the formation of vena cava. And in the left side, the sinus venosus will lead to the formation of pulmonary vein, right? The right sinus venosus will form the vena cava, and left one is going to form the pulmonary vein. So when this will go through the looping, right? So we have already discussed that they will go through the looping. Truncus arteriosus is not going to move, but the sinus venosus can move. And after the looping, they are going to form the heart. So finally, we learned that the heart will look something like this in the fetal life. So we learned that there is going to be the vena cava right here, and this area is going to be joining with the right atrium. At the same time, the pulmonary vein over here is going to be joining with the left atrium. So sometimes what happens, the pulmonary vein will not open in the left atrium, rather this pulmonary vein will open in the vena cava, right? So this is also regarded as the ASD, and this kind of ASD is called as sinus venosus ASD. Never forget this thing. So sinus venosus ASD is a different category. It's not the problem in the septum, rather it's the problem of pulmonary vein opening into vena cava, and more specifically, it is going to open in the which vena cava? Superior vena cava, right? Theoretically, it can happen even in the inferior vena cava, but it is going to be mainly seen in the superior vena cava. So what we understand that ASD can occur in any person of the atrial septum. It can be the secondum, it can be primum, it could be sinus venosus. In fact, there are many other different types of the ASD, but today we are going to only discuss about these three. We will not be discussing about others. So if I ask you, what is the most common type of ASD? Tell me which is the most common type of ASD? The most common type of ASD is
The first
Scandum.
one, second
secondum, right? So we have learned that the most common type of the ASD is secondum. Majority of the patient of the ASD are going to have the secondum ASD. And there are few things you must remember about the primum ASD and the secondum ASD. So remember, if I'm going to describe the differences between the secondum ASD, right, secondum and the primum, some differences, then there are few things you must not forget. Number one, the primum ASD is almost always, try to remember, almost always associated with the problem in the mitral valve, and the most common problem is going to be the mitral regurgitation. Never forget this thing. Again, I'm repeating that the primum ASD is almost always associated with the mitral regurgitation. At the same time, when we talk about the secondum ASD, that is the most common type of the ASD. The secondum ASD is very rarely associated with the problem in the mitral valve, and when they are associated, they are generally going to cause the mitral stenosis. They are not going to have the mitral regurgitation. And the situation when they are associated with the mitral stenosis, we call it Luteum-Becker syndrome, right? This syndrome where there is the secondum ASD associated with the mitral stenosis, then this kind of syndrome have been given a name. We call it Luteum-Becker syndrome, right? What do you call this one? What do you call this syndrome? We call it Luteum-Becker syndrome. Okay, so all of you tell me, which one is more common, the secondum or the primum?
Scandum.
Secondum.
Secondum, which is almost always associated with the mitral problem?
Primum. Yes.
Primum, and generally this
Primum.
is the mitral regurgitation or mitral stenosis.
Mitral regurgitation.
And sometimes,
Mitral regurgitation.
right, very good. And sometimes the ASD secondum, they can be associated with the mitral valve, and then it is going to cause the mitral stenosis. And this kind of phenomena, this kind of disease have been given a name. What do you call this disease?
Lotus Becker
Luteum
syndrome.
Becker.
Right, we call it Luteum-Becker syndrome, right? We have given a name to it, we call it Luteum-Becker syndrome. Now, one more thing I must not forget to tell you, that whenever the patient is having the primum ASD, generally they are going to have the left axis deviation, right? Generally going to have the left axis deviation. And those who are going to suffer from the secondum ASD, they are generally going to have the right axis deviation. And there is a very simple way I remember this thing. All of you tell me, which septum, the primum and septum, which one is right side and which one is left side?
so secondum
The primum is
on
in
the
the
right.
posterior and the left side, while the secondum is anterior and the right side, right?
Right.
So we can imagine that the primum is going to cause the left axis deviation, while the secondum is going to cause the right axis deviation. And the axis deviation is generally seen in the ECG. And in the ECG, what do we see is lead 1 and the lead 3. So keep in mind, in case of the right axis deviation, what will happen? The lead 1 is going to have this normal PQRS, and their PQRS is mainly going to have the downward, the negative deflection in the lead 1. And in the lead 3, you will find that the PQRS, the QRS is going to be having upward deflection, right? So if you see that the lead 1 is having downward deflection in the QRS and lead 3 is having upward deflection in the QRS, then we say that this patient is suffering from the right axis deviation. At the same time, when you find that the lead 1 is having the upward deflection and the lead 3 is having the downward deflection, then we can say that the patient is having which axis deviation? Right axis deviation or left axis deviation?
Right.
Right, so never forget, if the lead 1 is having upward and lead 3 is having downward, then we see that the patient is having left axis deviation. When the patient is having downward and the lead 3 is having the upward, then we say that the patient is having right axis deviation. So there is a very simple mnemonics that we use generally to remember this thing. Don't forget, if I'm drawing the ECG, all of you have to see this thing. If I'm drawing a ECG and in the lead 1, the ECG is showing that there is the QRS is downward, and in the lead 3, the QRS is upward. Okay, so you tell me this is the right axis deviation or left axis deviation?
Right axis deviation.
Right, so this is the example of right axis deviation, and there is a very simple way we remember. We say that right reaches, right, and left lives. This is the way how we remember this thing. So right reaches and the left leaves. So never forget. In case of the lead one, the QRS is going downside, and in the lead three, the QRS is going upside. So they are trying to reach each other. So a way to remember that whether it is called the right extremation or left extremation is by remembering this mnemonics: right reaches and left leaves. So if I'm doing the left extremation, what will happen? In the lead one, there is going to be more upward deflection like this, and in the lead three, there is going to be the downward deflection. So what you can see, in this one it is going upward, and in this one it is going downward. So are they reaching each other or leaving each other? Are they reaching each other or leaving each other?
Link.
Right. So since they are leaving, so we can very clearly see that the patient is having the left axis deviation. Okay, so now I'm going to give you some properties, and if people tell me which type of ASD I'm saying. This ASD is the most common ASD. Which one?
Scandum.
Secondum.
Second, very good. This ASD is almost always associated with the mitral regurgitation. Which one?
Primum.
Hello, can you hear me?
Yes,
Yes,
sir.
sir. No, I'm
Yes, sir.
Okay, good. So I was saying that you tell me which one is the most common ASD?
scandum.
Secondum. And which one
Secondum.
is associated with the Luteum back syndrome?
Scandum.
Secondum.
Very good. And which one is having the right axis deviation?
Secondum.
Secondum. Very good. So in this way, we can find that these are the common differentiating factor between the secondum and the primum. And do not forget, you tell me in the sinus venosus, the connection is between the channel is between where to where? Where is the channel? From the pulmonary vein to where?
superior vena cava.
Right, from pulmonary vein to superior vena cava. So don't forget this thing. So theoretically, it can be even the inferior vena cava, but most likely it's going to be the superior vena cava. Okay, so now after learning the types of the ASD, then our job is to learn a few more things here. Keep in mind, the isolated secondum ASD are going to account only for 7% of the congenital heart disease, right? You already know. If I ask you which is the most common congenital heart disease, what is your answer? Most common,
VSD.
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 Which one is the most common acyanotic heart disease? Acyanotic.
VSD.
VSD.
Which one is the most common cyanotic heart disease?
Tetralogy of Fallot.
Very good. Tetralogy of the Fallot is the most common cyanotic heart disease. Okay, now here you can see that majority of the ASD are going to be sporadic, means there is no any inheritatory situation, there is no any inheritance. But there is one particular syndrome, we call it Holt-Oram syndrome, and this Holt-Oram syndrome is going to be the example of the inherited disease, and it is going to be always going through which pattern? Autosomal dominant or recessive?
Dominant.
Right, it goes through the autosomal dominant. Very good. Okay, now if we are looking at the Holt-Oram syndrome, there are triad of the Holt-Oram syndrome. Keep in mind one very important thing, you already got that idea that Holt-Oram syndrome is going to have the ASD. And by the way, which kind of ASD it is going to be? This primum or secondum? In the Holt-Oram syndrome, most time the ASD is going to be which one? It is going to be secondum.
Secondum.
Right, very good. And not only that, you can see that there is also going to be the first degree heart block, right? So the number one problem is the ASD, number two problem is the first degree heart block, and number three problem is that in these children, they may have their limb near to their body. So all of you look at this picture. The arms and the legs, they are very near to the body. And this condition is called as phocomelia, right? So what do you call this condition? Phocomelia. All of you try to define the phocomelia. Phocomelia is? Phocomelia is a situation in which the arms, the limbs are very close to the center of the body. We call it phocomelia, right? At the same time, all of you look at this particular child. He's having the Holt-Oram syndrome. He has got the first degree heart block. He has got the ASD. Now, all of you count how many fingers are there in this child? 1, 2, 3, 4, and 5. Right? So, how many fingers he has got?
5.
5 fingers. But here you can see when you are looking at this thumb, then the thumb is not looking normal, because normally the thumb have got only 2 phalanges, but in this child there is going to be something called as triphalangism, right? That triphalangism means even the thumb is going to have three phalanges, not two phalanges, rather three phalanges. Then the thumb will also look like the other fingers, and we call this condition as triphalangism. Never forget that. We call it triphalangism. So this is the feature of the Holt-Oram syndrome. So I told you the child may be having the phocomelia. Or tell me, define the phocomelia. What is phocomelia? What is phocomelia?
Arms
Arms
and
Limbs
and
legs.
and
legs are
The
arms
near
are
the
limbs
center.
are
center
very
of
close
body.
to the body.
Right, very good. The phocomelia is the condition in which the limbs are very, very close to the center of the body. And another very important problem, I told you that these children are going to have the triphalangism, means there are three phalanges in the thumb. Sometimes these children may not have any thumb, so they're going to be absence of the thumb. Sometimes the radius bone is going to be absent. Sometimes even there is going to be a hypoplastic thumb. So these are all the features of the Holt-Oram syndrome. So do not forget, the triad of Holt-Oram syndrome is going to have the secondum ASD, is going to have the first degree heart block, and the problem in the limbs. For example, the phocomelia, for example, the triphalangism, for example, the absent radius, for example, the absent thumbs, or for example, the hypoplastic thumbs. And one more important thing I must tell you here, that the Holt-Oram syndrome is going to be located, the problematic gene is located in the chromosome number 12. Never forget this thing. The Holt-Oram syndrome, the problematic gene is located in which chromosome? Chromosome number
12.
12.
12.
Right, very good. Okay, so till now what we learned? Or tell me the common types of ASD. What are the common types of ASD? What is the most common one?
Scandum.
Secondum, very good. And which one is almost always associated with the mitral problem?
Primum.
Primum. Which mitral problem?
Mitral regurgitation.
Mitral regurgitation. You tell me which one is associated with the Luteum-Becker syndrome?
Scandum.
Secondum.
Secondum, very good. You tell me which one is having the right axis deviation?
Secondum.
Secondum,
Scandum.
very good. And the primum is going to have the left axis deviation. And do not forget, to determine with right and left axis deviation, we need to look at the lead number 1 and lead number 3. And we have got a very simple mnemonics. We call it right reaches and left lives. Right. So do not forget these things about the
Leaves.
ASD we have learned. Okay. So now very quickly, all of you tell me what is the triad of the Holt-Oram syndrome? What a triad?
Secondum ASD. First
ASD.
degree.
Okay,
First
First
very
degree
degree
good.
heart
heart
block.
block.
Very good.
Problem limbs.
And phocomelia.
Phocomelia,
Okay, more.
Absence thumbs.
triphalangism,
Okay.
and absent thumb.
Hypoplastic thumbs.
Okay. Right. So these are the
Hypoplastic thumb.
very good. So these are the common feature of the Holt-Oram syndrome. Okay, now I'm going to give you some more information about the patent foramen oval. So you tell me, foramen oval is a necessary channel during the fetal life or not? Is the foramen oval an important channel during the fetal life or not?
Yes, sir.
Yes,
Yes.
sir, it is.
But you already know
Yes,
that the
sir.
foramen oval, as soon as the pressure in the left side will increase, as soon as the baby will be born, the pressure in the left side will increase. Then, since the foramen oval is leading to a one-way kind of valve, then the blood from the left side cannot come to the right side, and the foramen oval functionally closes. And later on, the foramen oval is going to convert into something called as fossa ovalis, right? So it is going to call it as fossa ovalis. But let me tell you a few things here. Number one, in some children, what will happen? The foramen oval will not convert into fossa ovalis. It will not convert, and it will be called as the patent foramen oval. When the in the children when fossa ovalis cannot be formed, then we call it patent foramen oval. But keep in mind that a patent foramen oval is a very, very common finding during the infancy. If we do the echocardiography of majority of the children, majority of the child, they are going to have the patent foramen oval during the first year of the life. But although they have the patent foramen oval, but there is no hemodynamic significance. It is not going to cause any problem. There is no hemodynamic significance of the situation. So you can imagine that majority of the children, they are having the patent foramen oval, but there is no hemodynamic significance. That's why the most standard book of the pediatric, the Nelson, it very clearly says that the foramen oval is not regarded as a part of ASD, right? The patent foramen oval is not, the PFO is not regarded as the part of ASD. But there are many doctors, many scientists, many professors in the world, many books in the world who still regard the PFO as the part of ASD. But since it is found in majority of the children, and since it does not cause any hemodynamic situation to the child, we can say that PFO is not in fact the ASD. But at the same time, I must tell you that if the children who are having the patent foramen oval, they may always go through the paradoxical systemic embolization, right? They are always vulnerable toward getting the paradoxical embolization. So now let me explain what is the paradoxical embolization. So all of you think about this. If I'm drawing your right heart, suppose that is your right heart, suppose that is your left heart, right? And suppose that this is your lung in between. So you already know the vena cava, they drain into the right heart, right? The vena cava, they drain into the right heart. The veins, they are draining the right heart. While from the left heart, we have got the aorta and the arteries going out, right? Like this. So this is the circulation. And of course, from the right ventricle, we have got the pulmonary artery. And from the left, from the lungs to the left atrium, we have got the pulmonary vein. So now all of you tell me, if somebody is having some thrombus formation in the vein, and you know that in the society that the deep vein thrombosis, the DVT, is a very common thing. So now all of you use your brain. If somebody is having the thrombus in the vein, this thrombus, when they will start moving, when they will reach to the heart, this thrombus is going to cause the problem in the systemic circulation or pulmonary circulation. From the right side, it will go to the systemic circulation or pulmonary circulation.
Pulmonary.
Pulmonary circulation.
Pulmonary.
Never forget. Venous thrombus are going to lead to the problem in the pulmonary circulation. But now let's imagine some child came to you and this child is having an abnormal opening between the right and left atrium. Let's say the PFO or let's say the ASD. So now you tell me, can this thrombus from the vein, can it directly enter to the left atrium or not?
Yes, sir, it can.
And
Yes, sir.
can it go to the artery and can it block the arteries of the body or not? Can they go to the systemic circulation or not?
Yes, sir.
Right, and they can lead to the stroke, they can lead to the cardiac myocardial infarction, they can cause the splenic infarction, they can cause the renal infarction, they can cause lots of systemic embolization. So normally, you tell me, normally the venous thrombosis in a normal person, the venous thrombus, they cause the problem in the pulmonary circulation or the systemic circulation? Normally
Pulmonary circulation.
pulmonary circulation. But if somebody is having some abnormal channel between the right and left atrium, then what will happen? The venous thrombus can even cause the problem in the systemic circulation. And this kind of embolization have been given a name. We call it paradoxical systemic embolization. Means the venous thrombus, which was supposed to go to the pulmonary circulation, now they reach to the systemic circulation. That's why we call it paradoxical systemic embolization, right? So do not forget. All of you tell me, is the PFO regarded as the ASD?
No,
No,
sir.
sir.
No.
No, sir.
Is the PFO a very common finding in the echocardiograph of the infant or not?
Yes, sir.
And can it be causing the hemodynamic significance or not? Does it generally cause the hemodynamic significance?
No, sir.
And that's why we do not regard it as ASD. But still, you have to keep in mind that if somebody is having the patent foramen oval, can this child may develop the paradoxical systemic embolization or not?
Yes, sir. They
Yes, sir, it
Can
can.
develop the systemic embolization. Never forget this thing. Okay, now let's do one more thing. All of you tell me, what is the meaning of Luteum back syndrome? What is the meaning of Luteum back syndrome? What is the meaning of Luteum back syndrome? Tell me.
Sir, mitral stenosis occurs
Right.
in scandum.
Right. Along with the secondary ASD, if there is the mitral stenosis, then we generally call it Luteum back syndrome. Okay, so now we are going to begin with the ostium secundum defect. And before going to that, my computer is saying that our session is about to be over. So I'm going to stop this session. I'm going to begin a new one, and most likely your password will not change. Right. So see you after the session.